Hey there, parents and caregivers. If you are looking for a natural way to support your autistic child's gut health, brain development, and even speech and sensory issues, you are in the right place. My name is Pooja, and welcome into my corner of healing world. Today, we are diving deep into the GAPS diet, what it is, why it works, and how you can implement it step by step for your child. Stick around because this could be a game changer.
Let's talk about why follow GAPS diet and what impact it may have on your autistic kid. Did you know that 70% of autistic children struggle with digestive issues? Research now shows a powerful link between gut health and brain function, called the gut-brain axis. When the gut is inflamed or imbalanced, it can worsen autism symptoms like speech delays, sensory overload, and behavioral challenges. But there's hope. The GAPS diet, developed by Dr. Natasha Campbell-McBride, is designed to heal the gut, reduce inflammation, and support brain development. In this presentation, we will walk through exactly how it works, the science behind it, and how you can implement it step by step for your child. Let's start with why gut health matters so much for autistic children. The gut is often called the second brain because it produces neurotransmitters like serotonin and dopamine, critical for mood, focus, and communication. Many autistic kids have a condition called leaky gut, where toxins and undigested food particles seep into the bloodstream. These triggers inflammation that can reach the brain, contributing to foggy thinking, speech delays, and sensory sensitivities. All diseases begin in the gut. It's not just a saying, but a solid fact. Let's know about gut flora. It is made of three groups: essential or beneficial flora that are usually higher in number in optimum conditions. They are the good bacteria inside the gut. The opportunistic flora, lower in number in general, but they take sides of the higher numbered bacteria and work like them. For example, if there are increased number of bad bacteria is present in the gut due to some infection or toxication, the opportunistic take the side of bad bacteria and behave like one of them. Then there are transitional flora. This type we often swallow with food and drink from environment. When the gut is well protected by beneficial bacteria, this group goes through our digestive tract without doing any harm. But when the population of beneficial bacteria is damaged and not functioning well, this group of microbes can cause damages. What are the roles of gut flora? The first role would be their protection from invaders. They implement the health and integrity of the gut. They help the appropriate digestion and absorptions for the gut. Of course, they produce vitamin. They help with the essential detoxification process, and also they help to build immune system modulation. So, what can damage gut flora? There are certain things that can damage our gut floras. For example, antibiotics, steroids, any other drugs prescribed by any infection conditions for a child, stress, poor diet, infections, any kind of disease or inflammation, bottle feeding in the very early phase of life, pollution, this could be air pollution or soil pollution or noise pollution or any kind of pollution, radiation, toxic chemicals, and the dental work. The chemicals usually leach out to our guts. This is how a healthy intestine may look like in microscope. The small chain of beads looking cells are known as enterocytes. They are the very helpful mucus producing cells of intestine. Let's see how the life cycle of enterocytes work like. So the cells are generated, get matured, do their work. Eventually they get old and get shed off. New cells always takes place. And in any toxic agent cases, if the cells are not regenerated, then what happens? The known factor, the very known name is gut dysbiosis. That is a sick condition of the enterocyte. Here is a closer look into the cells. This is how a healthy enterocyte may look like. Those hairs on the enterocyte represents this microvilli. As the enterocyte cover the surface of the villi, their hair, this microvilli, make a so-called brush border, which is very essential for the last stage of digestion of any kind of food. The right-hand side, we can see the sick enterocytes are in case of gut dysbiosis. So what happens when the gut wall is damaged? There are a lack of protection from beneficial gut flora, of course. They will be attacked by pathogenic microbes and toxins. Enterocytes degenerate, tight junctions open. This is known as blood-brain barrier. This usually opens and those flood of toxins can reach easily to our brain and then the brain fog happens. Food absorbed partially digested leading to food allergies and intolerances. Damaged gut leaks toxins and microbes into the bloodstream. General toxicity in the body. Immune system reacts, adding autoimmune. How does a typical gap scenario may look like for a child? Or to say, in which conditions a child becomes a GAPS child? If the parents are already present with gut dysbiosis, then of course the child have higher tendency of becoming a GAPS child. The baby does not develop normal gut flora, maybe immune system compromised, any kind of ear infections and chest infections or antibiotics are given in very early stages of their life. Further damages to gut flora and the immune system. Vaccinations are the major cause. Usual weaning diet or processed foods. Gut dysbiosis leads to a damaged gut wall. Toxins, microbes, and undigested foods enter the body. Toxins entering the brain cause gut and psychology syndrome. Toxin entering other organs cause gut and physiology syndrome. What are the common gut syndromes for a child? These are gaps addressed by removing food damage the gut lining, like gluten, raw dairy, sugar, while adding healing foods like meat stock, fermented vegetables. Those names are quite known for all of us, like autism, dyslexia, dyspraxia, learning behavioral, social problems, epilepsy, tics, ADHD. These situations could be altered by repairing the gut. We may see improvements in behavior, languages, and even social interaction. Thus, a comprehensive diet approach would help the autistic kid to overcome the difficulties. A customized diet chart along with meal plans and other details tailored to particular needs for each kid would be very effective in this regard. This is how a customized diet plan may look like. They are totally calorie oriented and very much targeted for individual needs. They are culturally developed and they are seasonal. Parents who have tried the GAPS diet often report remarkable changes. One mother shared that her nonverbal 4-year-old began saying words like mama and more after just 3 or 4 months on the diet. Another one noticed her child's violent meltdowns reduced by nearly 80% once gluten and raw dairy were removed. And a study published in the Journal of Autism and Developmental Disorder found that children on similar gut healing diets showed significant improvements in attention and eye contact. While results vary, these stories highlight how fixing the gut can unlock a child's potential. So, are you ready to start? Here's the GAPS diet broken into 3 phases. Phase 1: remove harmful foods like eliminate gluten, raw dairy, refined sugar, and artificial additives. These feed harmful bacteria and inflame the gut. Phase 2 would be add healing foods, introduce meat stock packed with collagen, good amino acid profiles, especially glycine and proline to repair the gut lining. Fermented foods like sauerkraut and coconut yogurt restore good bacteria. And don't forget healthy fats like avocado, ghee, or any kind of animal fat, which fuel brain development. Phase 3 would be reintroduce foods slowly after certain times specified by your GAPS professional. Taste small amounts of nuts, maybe which are banned at that time, which are asked not to have, cultured dairy or other eliminated foods, one at a time. Keep a journal to track reactions. To make this easier for your child, blend soups or smoothies to hide veggies. Try probiotic supplements if they refuse fermented foods. Be patient. It takes usually up to 24 months maybe to see major changes, but sometimes it's as earlier as like 3 or 4 months, especially if their kids are younger. And avoid these common mistakes like quitting too soon. Healing takes time, not tracking symptoms. A journal helps spot progress. Overloading on nuts too early, they can be hard to digest. The GAPS diet isn't a quick fix, but for many families, it's been a lifeline. By healing the gut, we give autistic children's brains the clean fuel they need to thrive. For a free basic GAPS gut healing recipes, check the descriptions below. And if you have tried the GAPS diet, share your story in the comments. It might inspire another parent. Thanks for listening to me today. And remember, small steps can lead to big breakthroughs. That's all for today. Please like and subscribe the channel if you like to know more about GAPS diet and how this helps your autistic kids. Thank you.